Medication errors in evidence-based practice in healthcare delivery. Patient-centered nursing practice is based on the ethical principles of beneficence and non-maleficence. However, in certain circumstances, patient safety may be negatively affected by predominantly unintentional medication administration errors. Cloete defines them as preventable events related to medication which results in a failure in the treatment process that leads to or has the potential to lead to harm to the patient. In the present day, medication errors are among the most common causes of harm to patients in the healthcare industry. According to the research dedicated to the prevention of medication errors, this type of misconduct in medical settings regularly leads to 6 to 7% of hospital admissions in the United States. In addition, a considerable number of medication errors remain unreported. That is why scholars, lawmakers, average physicians, medical assistants, and nurse practitioners in particular need to understand the reasons for medication errors occurrence to prevent them in the future. In general, there are multiple causes of medication administration errors that have a different origin. Cloete divides all medication risk factors into patient, system, and personal. The category of patient factors relates to patients' characteristics and attributes and traditionally includes multiple medication use due to various health issues, poor communication caused by language barriers, complicated drug calculation, and the absence of a patient's interest in their treatment. System factors that may lead to the occurrence of medication administration errors imply poor management, leadership, and communication, the absence of a safety culture in a medical organization, and inappropriate working policies. In turn, personal risk factors are connected with the personality of a healthcare provider, their situational awareness, decision-making, cognitive skills, and responses to stress and fatigue. In general, it is nurse practitioners who play a highly essential role both in the occurrence and prevention of errors as they are responsible for the provision of accurate performance and interaction of all professionals. Several strategies may be implemented in medical settings to reduce and prevent medication administration errors in the future. First of all, particular attention should be paid to the licensed nurse's computation skills and the ability to interpret received information for the patient's correct treatment. Moreover, registered nurses should have understandable handwriting to prevent miscommunication and medication errors. In addition, comfortable working conditions for healthcare specialists are immeasurably significant as a substantial number of medication errors occur due to the nurses' high workloads, fatigue, and stress. The re-evaluation of current conditions with the help of transformational leadership and the official regulation of schedules for nurses will help them to concentrate on their duties and patients more efficiently. In other words, healthcare providers who are satisfied with their job have more opportunities to build solid relationships with patients and colleagues based on trust and respect. Moreover, the introduction of the double-check system implies that all activities are checked by another specialist to exclude inaccuracy, absent-mindedness, and negligence. Finally, one of the most efficient strategies related to the prevention of medication errors is the implementation of electronic health records in medical organizations. There are several major advantages of this practice. First, it helps to avoid the risk of errors connected with an absence of proper communication between clinicians. All necessary information related to medication administration of every patient put in a system will be available for specialists involved in treatment. Moreover, an electronic format of data excludes potential misunderstandings that may occur in the case of poor handwriting of a prescriber. In general, evidence-based practice implies the combination of person-centered care based on the patient's individual and cultural values with clinical expertise and valid research evidence. This evidence is collected, evaluated, and integrated to provide accurate and time-sensitive decision-making. Evidence-based knowledge is immeasurably essential for nursing practice as it contributes to the development of efficient healthcare delivery. Moreover, evidence-based practice is connected with the best nursing practices to ensure patient safety. That is why, as a healthcare specialist, one should learn how to combine appropriate evidence with clinical research and patients' needs, values, rights, and preferences within the framework of practice. As evidence traditionally refers to findings from data collection based on experiments and observation, I currently see my role in evidence-based practice as a healthcare specialist who delivers healthcare with simultaneous monitoring of patients' health. I need to develop cognitive skills and concentration to pay attention to even insignificant changes in their health condition. In addition, an appropriate level of education and professional knowledge is essential for the correct analysis of received evidence. It goes without saying that the cultural, religious, and individual peculiarities of patients should be considered as well to interpret the evidence correctly for appropriate conclusions.